Have you had trouble to pay your medical bills? Have you ever delayed your medical care because of fear of how much it will cost you? Have you ever delayed to see a doctor for months or even for years because you were afraid that you will be hit with that astronomical bill? Then you are not alone. 137 million Americans have faced financial hardship this year because of medical costs. The number one reason in the United States for filing bankruptcy is due to medical bills. But what is the solution? Watch this video until the end and I will teach you the most important tips to save you from medical bankruptcy.
Rheumatologist OnCall.com.
Hi, I'm Dr. Diana Girnita, and today I will give you those tips that you need to avoid medical bankruptcy in the United States. Unfortunately, it doesn't matter if you have medical insurance or not these days, because both categories of people will face the same challenges. Why? People with healthcare insurance, every year you pay. Actually, we all pay higher and higher premiums, and more recently we pay high deductibles, and these are money that you are responsible to pay before your insurance will cover anything, and these are most of the time thousands and thousands of dollars. Plus, there is no guarantee that you will get the medical care that you need, and you will realize that what I'm telling you is correct when you actually need to use your medical insurance. At that time, you will realize that healthcare insurance does not equal medical care. Now, let's say you need to see a specialist like me. Then you will soon realize there is no one that you can see for the next 6 months because your insurance does not have enough specialists that will take your insurance. Then let's say you need a test, like an MRI or a treatment. Your insurance will deny the test as many times because they will consider that test is not medically necessary. And even when they approve the test, you may still be responsible to pay either a portion or even the full amount. Please read the small print. When your doctor sends a test to be pre-approved, then your healthcare insurance will respond with a letter that most of the time will say that they do not guarantee that they will pay for the test. And if they don't pay, who's going to be responsible for paying? You. Every time when you go to a doctor in a traditional system or an emergency room from a big hospital, first they ask you to pay or they ask you to sign in case that your insurance will not pay for your care. Now let's talk about people without medical insurance. They will delay their medical care for years. The medical situation and their health will deteriorate, and when they go to the doctor or to the hospital, most of the time they are in a critical situation, and that will result in even higher, more complicated stays in the hospital and higher prices and eventually higher medical bills. That is why, unfortunately, too many people face bankruptcy in the United States due to those astronomical medical bills. But you don't have to be a victim of the broken U.S. healthcare system, because in this video I will share with you strategies that can help you get affordable care and steer you clear from crippling medical debt. Tip number 1, understand your insurance plan. I want you to review your policy details annually. Make sure that you know your deductibles, your copayments, if you can be seen in or out of network, because many HMO plans will not allow you to be seen by other physicians outside of their networks, and they will not pay if you don't get a clear approval before you see a specialist, before you obtain a test or a medication. HMO plans are very restrictive. The PPO plans are also restrictive, so make sure you understand your benefits very well. Tip number 2, avoid the ER for non-emergency situations. Emergency rooms are extremely expensive for non-life-threatening issues. A study from 2019 showed that an ER visit for a relatively minor issue will cost you about $3,000. Let's say you have an upper respiratory infection, something that doesn't look very complicated, or you have a mild asthma attack. Then you should look for an urgent care, look for a telehealth appointment with another physician, or you can use direct primary care doctors that can help you. Now, direct primary care doctors are not contracted with insurance companies, and for a small monthly fee of $75 to $150 per month, they can take care of all your primary care needs and urgent situations. If you need a specialist, there are also specialist physicians like me that will take care of you, take care of your needs when you need them the most, and you don't have to have a referral, and you will get a transparent and affordable price. If you never heard about DPC or Direct Primary Care movement, watch this video here and check out the website in the comments of this video because you will find a doctor close to you. Tip number 3, always ask for a cash price. Don't assume using your healthcare insurance is cheapest. Recent data shows that the hospital systems, hospital-owned laboratories, or hospital-owned imaging centers, or insurance-owned pharmacies like OptumRx, CVS, or Walgreens can inflate the cost by 200 or 400% for the same service. Let me give you an example. For one of my patients, she was paying with her insurance, so through her insurance, for Celebrex, which is a medication, an anti-inflammatory medication for arthritis. She was paying every month $25 for a 30-day supply. So a 90-day supply was about $75. However, through my practice, I was able to offer her the same medication through another pharmacy, of course, for $9 for 90-day supply. This is a great saving for the patient. Now let me give you another example. My daughter was suffering from headaches for a few weeks, and I have requested to see a neurologist and eventually to get a brain MRI. The insurance approved to see the neurologist in 4 months. Remember, she was in pain for about 2 weeks. The cost of the MRI through the hospital was quoted to about $2,000. I went and asked for the cash price from a local imaging center, and I paid $225. Now, how about that? So once again, do not assume that the cost of your labs, test, or medication is lower because you have healthcare insurance, and don't be afraid to ask for the cash price before you get any test or any medication. Tip number 4, use independent or direct care doctors. Instead of going to doctors employed by the big hospital systems or even doctors owned by the insurance companies, you should be able to choose your doctor. Do not let your insurance choose the doctor for you. You can also choose who you want to see. As I mentioned previously, there are independent specialists like me that are not contracted with insurance companies that will advocate for your health and will guide you on what is best for you. Independent doctors or direct care specialists will disclose to you the cost of their consultation and can even help you to find the best price for your laboratories, for imaging tests, or even for medication. They actually put you in the driver's seat. If you want to use your insurance for laboratory tests, for CAT scan, for MRI, or even for medication, then use it. Use it for your own benefits, but you will decide when to use it and for what services you are going to use that. But in this way, you will be the one who will decide what is best for you. I highly recommend you to read this book from Dr. Marty Makary, The Price That We Pay, where you will hear about many people's stories that were hit with surprise bills and how they used independent doctors. And not only that, but in my practice, I can offer patients transparent pricing for laboratory services, for imaging tests, and even for many medications. If you're looking for getting a cash price, you can try all these links that I posted in the bottom of this video, in the comments of these videos. You can try this company called Green Imaging. You can try Simon Med. You can try ProScan. They all give you the cash price if you ask for it. If you need a better price for a medication, let me give you just one example out of many. There is this company or this pharmacy called Cost Plus Drugs Pharmacy. And I put the link right here for you to find better options when it comes to pay for your medications. There are also centers that will offer you cash prices for different surgeries, from podiatry surgery to hip or knee replacement, and I will list their names in the bottom of this video. I'll give you some examples like Wellbridge Surgical Center or Surgery Center of Oklahoma. So all of these are resources that you can use to find a better price for you. Now, if you decide to get a set of labs or a CAT scan or an MRI or even do a surgery, shop around. Like for anything that you do in life, like for all the things that you buy in your life, shop around and decide what is best for you financially and for your health. Tip number 5, take advantage of HSA and FSA accounts. HSA is health spending account and FSA is the flexible spending account. HSA and FSA, these are funds that will allow you to set aside pre-tax dollars for out-of-pocket costs. For some of these accounts like HSA, you may roll over money from year to year. So these accounts can act as an investment account with withdrawals that are tax-free for qualified expenses. Tip number 6, ask about payment plans and discounts. If you are hit with a major bill, see if you can qualify for an interest-free payment plan that will break it into affordable installments. Never pay the first bill, as Marshall Allen advises in his book. Why? Because you can always negotiate your medical bill. First, make sure that you ask for an itemized bill where it will be clearly stated exactly that you need to pay. And if you find out that there are medications or procedures that were not done to you, you should refuse to pay those. If you find out, for example, that you had a charge of $500 for using a few pairs of gloves, that is unreasonable, and you can always ask to be charged to a fair market price. Many hospitals will offer you steep discounts, about 20 to 50%, if you pay a lump sum upfront and if you meet certain income criteria. In conclusion, with medical costs being the #1 cause of bankruptcy, no one is immune to this outrageous U.S. healthcare system. But today, you have many other options, from choosing your doctor, to choose what you need to pay, to choose where to invest your money when it comes to your health. Because there is no better asset that you have than your health. So do not let others, including your insurance, to get into your medical care. Do not let them use your money and still pay outrageous bills. By taking these few proactive steps, you will find excellent medical care, affordable, transparent prices, and many times you're going to find cheaper prices that you found through your insurance. And now that you understand how to beat the system, how to avoid medical bankruptcy, you are going to watch this video that will show you exactly how to find better prices for your medical care in your local area.
Rheumatologist OnCall.com.